Hi everybody, this is Rhys Barber from Audiology Associates. Thank you very much for watching that earwax removal video today. We post new earwax removal videos every Monday, Wednesday and Friday at 9 PM UK time, so please consider subscribing. So what you've got here, we've got one patient that's come through with two very blocked up ears here, very thick, dark coloured wax. Now, the colour of wax is usually a good indicator of how old or how long that wax has been in the ear. So wax is slightly acidic, so the darker the wax gets, it means it's a lot older because that wax oxidizes with air, so it gets into much darker appearance. Now what you can see here is we've got the standard size ulnar tube in here, and we're just teasing this wax off this one canal wall. The reason being it's very sticky, so as wax dries it becomes stickier and more tacky and does tend to kind of stick against canal walls and sort of hold and lodge in there. But what you can see with this patient is that the wax has gone quite deep. It's stuck all around the outside edge, and we've got this central portion of wax which is actually covering the eardrum as well. So what we're having to do here is gently try and tease this away, slowly working this. You can see we're unpeeling it off the canal wall all the way down here. Imagine like you've got Play-Doh stuck to something and you're trying to gently peel that away without it breaking away. That's the kind of mechanism and action we're using here to try and tease this off. So we managed to stretch one little piece out here, which just kind of pulled off the outside edge. It's just starting to come away a little bit more effectively. We're lifting from the bottom and trying to detach this section to the top left corner as well here. What's happened is where we've drawn it down, it's brought the wax into a point, which isn't the easiest thing to get hold of with the suction tube. So what I've done here, I've introduced a little bit of olive oil in here, and what that's going to do is two things. It's going to help me to get a better grip, and it's also going to stop the wax from re-sticking back to the canal walls once we've unstuck it. So there's lots of kind of wiggling motions going on in here where we're trying to tease this left and right and up and down just to try and detach it from as many of those canal walls as we possibly can. There we are, you can just see it starting to move on the bottom section there. Quite impacted, so quite pushed quite deep into the canal, this one. It happens sometimes when people have used Q-tips or other bits and bobs in their ears to try and clear this out. It kind of compresses the wax together, so you end up with a really thick, sticky layer, which is what's happened here. There we are, we're just starting to see a little bit of movement there. As we got a bit of a grip on that base section then, the whole thing started to move forward, started to sneak down the canal a little bit. It's got a bit stuck here at the top, so I'm using this downward motion and backwards pulling, if you like, just to press it down and draw it past that little bump on the outer part of the ear canal there. Got quite a good grip with the suction. It is starting to come away very slowly. You can see the outer edge, which is slightly smoother. So that's the bit that's been stuck against the canal wall there. That's the bit that we're trying to pull down. Because it's so smooth, it's usually a little bit softer as well. We can get a good grip there and draw it down. But it's really not wanting to come out of this ear canal. It's really quite firmly wedged on this outer part. Just lots of manoeuvring a moment. There we are. It's all starting to come away. You can see that slightly drier section of wax, that more crumbly section there on the top. But yeah, quite a big old plug here. Very slowly working this down the canal. When you've got this kind of plug that's really stuck on the outside edge, sometimes you can go in there with a Jobson horn. Sometimes it's more difficult when you do that with this type of thing, because if the Jobson horn catches the edge of it, it can actually roll it back into place. So what I'm trying to do here, imagine you're trying to get something big into a small gap. You have to, what we call, walk it here in the UK. It's probably called something different in the US, but you kind of jiggle it back and forth and just slowly work each side in. I've got the crocodile forceps here. Because we've got this leading edge that's slightly thinner, we can pinch that, but unfortunately it's just not quite tough enough. So it just sheared that lip that we developed there off the edge. Let's see if we can work this forwards again now using the suction tube here. You can see just kind of wiggling from side to side, just trying to get it to move down the canal. Sometimes it can become quite sticky on the outside edge as well. So what's happening is as you draw it down, it's sticking to that canal wall, especially because we use a spray olive oil as well. It can get in that little bit further. So sometimes the olive oil won't have coated the outside edge. So as you're drawing this down, it'll just stick to that skin there. I'm really trying to kind of wiggle my socks off here to get this out. There we go. It's just so frustrating. It's just really almost there. We've developed another little lip here, so we're just going to see if we can clamp onto that with the forceps. You can see though, it just shears straight through them. Unfortunately, it's just not quite hard enough to hold on to. It's firm enough that you can get some movement to it, but not tough enough really to hold on to with a good grip with the forceps. Aiming for a slightly different spot now. There we are. You can see that little tiny wiggly motion there. That's really effective to try and really move it down the canal. And we're aiming for a slightly different area, because sometimes you'll find you'll get a little bit more movement to one particular area than you will with the others. You can see how dark this wax is, well, just how old this has become as well. There we are, got a good grip. You can see that bit of movement. There we are, it's on its way. We've slowed things down a little bit here so you can see this coming away. So there's that plug, almost put my teeth in, formed perfectly to the shape of the canal, but it's actually sheared a little bit off. You can see there's more just inside as well. And as we pull this top section, now we've taken some away. It gives us a little bit more room to maneuver in here. But you can see still quite a dry plug as well. Guys, I have got a couple of different little announcements to do in this video. The first is there'll be no oral bite video this week, just because we've actually got a clinic refurb next week, which me and Mrs. B are going to be quite heavily involved in. So I don't know yet if there's going to be any videos next week. Keep everything crossed. If I get time, I promise I'll do it, but it's going to be a pretty demanding week. We've got a lot to do here. So please bear with us over the next week. I will do another oral info bite video. You will get your gold stars, whoever got it right, but we may be doing that possibly the week after next. Okay, we've got quite a bit to get done in the clinic rooms here, so it's going to take up quite a lot of our time. So you can see this coming away, big chunky bit of wax there, come away, very, very dry. But when we look behind, there's even more wax behind this. You can see just how far down the canal this wax has gone. Very, very deep section here. We've got to be a little bit more careful. If you're a regular viewer to the channel, you'll know that this particular part of the ear canal is very sensitive. Eardrum itself very thin. So we're having to do some gentle maneuvering here. There we are. We've introduced a little bit of olive oil just to try and ease this wax along its journey to the outer part of the ear canal, help it to slide across the skin that little bit better. You can see that lighter material underneath there. That's a bit of dry skin. Okay, so as we pull this down, you can actually see where the skin's been holding on to this when it's dried out that much. It's actually dried around a layer of dead skin there as well. As before we got it to the outer part of the ear canal, you can see lots of little cilia there all around the outside edge of the ear canal. We got it right to the outside edge, so Jobson horn can come in at this point and just lever it out. There we go, out it pops into the bowl of the ear. There it is. You can see that lighter dead skin material underneath. So another quite big chunk come out of the ear canal there. Let's take a look behind that. There you can actually see that little white spot you can see there is almost like a little blister where it's been rubbing back and forth on the top. So you can imagine just how uncomfortable this would have been for the patient. So this is the same patient now, but the second ear, you can see a very similar looking wax in here, very dark in color again, quite smooth on the surface here as well. So I think the patient has been doing a little bit of polishing of that wax, maybe with a Q-tip there, but same kind of process. Let's lift it up from the side and stick it from the canal wall first of all. Oh, there is one more announcement. My father, Mr. B Senior, would like your help, which he's going to ask you about in a video I'm going to post after this one tonight. I'll let him explain, but stay tuned for that one. It's going to come on after this one. Yeah, he can do the explaining for that bit. So what you've got here is we're just taking away. There you go. We're just using the Jobson horn to scoop that section away there to the right-hand side. What we had here was a long, thin strip that had just stuck to the canal wall here, really just not allowing us to get a good grip and not allowing us to pull this wax out because we've got so much of it further in there. It's just not really budging. So we're using the Jobson horn here just to go around the outside edge, break away some of this tougher wax. We've always got to be a little bit more gentle when you're working against the canal walls, because when you're working and pushing into the canal wall with the Jobson horn or close to the canal with the Jobson horn, it can feel very uncomfortable for the patient. So always be mindful of that when you're doing this kind of extraction here. You can see lots of bits all coming away, smaller pieces breaking away first of all. Now, because we've switched tools and we're using the Jobson horn, you might notice there's a little bit of misting on the endoscope. Now, obviously, when you've got suction in there, any humidity that's in the ear canal gets sucked away with the suction. But when you switch to a different type of tool, especially when you use an endoscope like this, then when you're in the canal, then that humidity just kind of starts to fog and mist the endoscope just ever so slightly. So you are taking it out on regular intervals and just cleaning it off with a little bit of alcohol and going back in again. You can see that's what we've done here. So there's a little bit of olive oil gone in as well, which is going to help to unstick this from the side of the canal wall. You can see just how thick this layer is. It's a very, very thick layer coming away here. What I'm hoping we can do is if we can detach enough from this right-hand side, that's hopefully what's anchoring this last deeper section in. So if we can take this off and we can draw this out, then it's going to help to sort of take the whole chunk away with it then. But as you can see, normally when you do this, you lift a little bit and you'll start to see it peeling away. But what's happening here is it's quite thick. So as we're lifting, it's actually starting to get close again to the other end of the canal wall here. So I'm hoping it's going to detach before we reach the other side. Otherwise, that's going to be a little bit more problematic. You can see, as we did with the other one, that's like, there. Did you see it move then? That whole thing just detached. You've got a little bit more freer movement there. So the crocodile forceps is going to come into play now. You can see I'm just gently lifting the base of the wax with the bottom end of the jaws of the forceps there, trying to get a grip, really hoping that this is hard enough that we can get a grip on this to pull it out. But as with the last one, it just sheared straight through. So Jobson horn's going to come back in now. You can see we're kind of working around the side of this. See how much, how more mobile, that wax has become now. Before when we were using the Jobson horn, it wasn't really moving that wax, but the whole thing is starting to move. There we go. We've turned it through 90 degrees, and we just scooched the end out of the ear canal there. So we're going to get behind it now with the Jobson horn. There we go, out it pops. Very, very dark wax again, very, almost like a deep, almost ebony in color. So been in there for a long old time. Let's take a look behind that. You can see how pink those ear canals are. Look how squeaky clean that ear canal is though. Eardrum itself looking nice and healthy, no blistering as it was. Look at that, what's that? That's 1, 2, 3, 4, 6 centimeters, 2 3/8 of an inch. That's what that is. A huge amount of wax came out of there, guys. You know, between both ears, that was such a lot of wax. Well, guys, I really hope you enjoyed that video. Oh, don't forget to stay tuned for the message from Mr. B, which comes, Mr. B Senior, sorry, not myself, which is we're going to post in a video in about 5-10 minutes time. So, guys, as always, take care of yourselves, take care of one another, and I shall see you again real soon. All the best, guys.